anymore, and that drives people to seek care either with a massage therapist or a chiropractor. Now, the unique thing about the top of the spine is it cradles the head. And if you're in a trauma, what will happen is that the top of the spine will dance underneath the head, and then the rest of the spine will go underneath it. And if we're talking about the bottom of the spine, it's going to dance underneath the head like a waiter with a heavy tray of dishes. And the jaw, its job is to feed the head. And it's a unique joint in that it has a right and left side. And you've heard of a movable feast. Well, it is a movable vice. If you put a finger on your belly button and another one on top of your head, go ahead. And on top of your head. Now, bite down hard. You feel your belly button? Your jaw can generate 150 pounds per square inch of power in a man and 120 pounds in a woman. Now, the muscles that actually close the mouth, they're a quarter pound and a quarter pound. They're the temporalis, the masseter, which is, I call it the chunky monkey. When somebody gets mad, you'll see that one flicker. And then there's the pterygoid that goes and takes and draws the disc forward, and the lateral the medial pterygoid that are going pull it forward. So you have four muscles that will open and shut the mouth, and you've got the digastric, the front and back, and the hyoid, the top and the bottom for swallowing. So they're not significant enough to generate that kind of power. So what happens is that the jaw is made to rip and chew, masticate, get something that's out there in the street and make it into fuel for the body to sustain the head, the great sensory bulb. And what happens is there are a number of ligaments that keep this thing on the bottom from coming down. And they're the styloid mastoideus, the sphenomastoideus, lateral ligament, and the capsular ligament. And what happens is that in a fall, car accident, extensive dental work, a fight, the ligaments on one side can get stretched. And what happens is the muscles on the opposite side tighten up to get the back teeth together so you can grind and chew even in a distorted or a misaligned state. In my practice, I had an exam sheet, and on the front of the exam sheet, in the lower left-hand corner, it said jaw subluxation. And a full-on 20%, 1 out of 5 people that came in the office from 85 until 2017 had a jaw misalignment. Now, all of them weren't symptomatic, but the primary thing, commonality I saw with headaches, blue, is that they had a jaw misalignment. And that's what drew me to the study of the jaw. I would go and they would come in with a migraine, I'd adjust their neck, did it by the book. 2 weeks later, they would come in, they were misaligned again, which is kind of unusual. They'd have a headache again, I'd adjust them again, the headache would go away, and this thing kept going. And what I saw when I looked at their exam form, the commonality of those people with migraines or persistent headaches was a jaw misalignment. Now, if you hurt the top of your spine, you're going to get a stiff neck. If you hurt the bottom of your spine, you get a sore low back. If you hurt your jaw, you're going to get a sore head. So what happens is that I also saw there is a persistent trigger points that showed up, and they're called Levator Scapulae trigger points. So if the jaw went high on the right, typically, and the misalignment or the stretching of the ligaments would be on the opposite side, the good side would tighten up, and the trigger points would be underneath the skull in the corner right here. And then, as they would say in Gadsden County, you follow this leader down and it's right there, and that would be a big knot. And there'll be another one right here. Now, also, when you're taking care of people, when you're doing massage or chiropractic, what you found is the companion structure for the jaw is a pelvis. So, like a old-fashioned screen door would have a guy wire going across and a turnbuckle and hook to the other side, keep the door plumb. What would happen is that we'll say we got those trigger points again, here, here, and here. But what we would find is an unstable SI joint on the opposite side. That would be most of the time. I can't give you any numbers on that. But if you had the misalignment of the jaw hiked up on the right, the trigger points on the right, and the pelvis on the same side had misaligned, then what happened is it would pull down across like that, and there would be what they would complain about as a nail being driven into their back. In other words, it had been pulled from the top and the bottom. Now, typically what you would do, what a chiropractor might do, is look to that point to get rid of that pain. And typically be in the middle of the spine, the halfway point, a stress point in the spine, you're going to find something, but that's not the cause. So the jaws, it has far-ranging effects on the rest of the body because of importance, its size, its power, and what muscles are recruited to make that ripping and chewing possible. Now, the jaw hinges on the temporal bone. Besides headaches, it can cause vertigo because the jaw articulates on the temporal bone. The ear hole is about ½ inch away, halfway down the ear hole's middle ear. And typically you're going to find that in people that are a little bit older. But there's a direct relationship between the jaw and that vertigo for that person. Now, the other thing that will happen with people that have a jaw problem is they're going to have a stiff neck, and it's from those trigger points. So the important thing is that when you run into somebody that has a problem at the top of the spine, the bottom of the spine, or the jaw, that you have a way to assess what those things are and see if you can get that person to the right person to take care of them. Now, nobody escapes the fact that your body is going to compensate for old injuries. Everybody in this room has things that have happened to us in the past, and we're not going to get rid of them. And the reason we're not going to get rid of them, that they're going to come back, is not because who's taking care of us is incapable or isn't trying hard. It's because of what got hurt. And what got hurt were ligaments. They don't have a lot of blood flow. Once stretched, they stay stretched. So the quality of somebody's life can be determined by how we handle these compensations, and whoever we go to, if they're sharp and get us to the right people, and if we're consistent over time. And some people, and we've all encountered it, consider it to be in our society whether we want a pill for a nail. In other words, that the answer for the problem is we have too many organs or not enough drugs. And the reality is that we have to find out what the problem is, find the right person to take care of us, and then we have a lifetime of taking care of it. And it's not because anybody's mean or we want it to be that way, it's just the way it is. So another thing about the jaw is that when you're stressed, this thing will manifest stress. And if there were two guys in the day room at First Instructor Company, Fort Lee, Virginia, in 1969, I can see it now, they were getting up too close to each other and talking about each other's mothers. And one of them said to the other, "You give me a case of tight J's, tight jaws." So if they had seen the other guy's masseter muscle, the chunky monkey, flicker, they would know that they either had to run or drop him because something was going to explode. So what happens is that as we get stressed or internalize stress, what happens is something that's already there, a misaligned jaw, will tighten up, and typically it'll become symptomatic on the side that the jaw goes up and typically back, not always. So what I want to do right now is I'd like to show you folks how to go and check and see if somebody has a jaw misalignment. The first thing that really what they're going to do is they'll tell you before you even work on them, because if there's an intake form, it'll show the trigger points here, here, and here. And they might have unstable SI joints, they might have headaches, or they might have vertigo or a stiff neck, and you go ding, 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 ding. So there's the trachea on the ear. Go and put your fingers up here and just draw it forward with your fingernail, barely touch it, maybe 3/4 of an inch. Now open your mouth, and it should lift on the top of the jaw. I don't know if you can see mine, but mine goes high on my right side. Can you see that? So the side that goes high, you can take your finger and barely touch it. I wouldn't do it right now. I mean, I'll walk around and check all of you, but you barely touch it. And it seems too easy. It seems like it shouldn't work, but the odd thing about it is it does. So, can you see where mine hikes up?